vaccine should just completely be eliminated, it would be that, because it doesn't keep people from getting sick. You know, I always say that in the U.S., one of the things that the CDC and U.S. government is really, really good at is keeping stats. I mean, you can find stats and tables and statistics on just about anything, and they go back into like the 60s. You know, you can find tables on the number of cases of measles per state all the way back to the 1960s. So what they're really good at, like accumulating numbers and data and stats. So one of the things with the flu shot is that in the U.S., they have 120 different testing sites. So if people have what appears to be influenza, you know, the deep body aches, the fever, cough, those things, they can go into one of those testing stations, and they can get a nasal and a throat swab done, which they then send to the CDC to be tested. So in the first drop, they bring in the nasal swab, and they test it, and they say, is it an influenza virus, or is it something else? And over the last 19 years, they test over 600,000 swabs per year. And over the last 19 years, because I've looked at their data, that those little data entry people do really, really well. And the first drop of that, only 15% of the time, is the illness caused by influenza viruses. The rest of the time, it's caused by something else called an influenza-like illness, because it means it gives you all those signs and symptoms of having the flu, but it's not caused by influenza. So that means if you get a flu shot, it's only going to if it works at all, it's only going to keep you from getting sick 15% of the time. So you can get sick of everything else. Well, in that other influenza-like illness category, about 40% of that illness worldwide, year after year, is caused by a coronavirus.
Okay.
So the coronaviruses have been out there for a really, really long time. More than 60 years they've been in humans, and it causes a lot of illness, which means that they've been trying to develop a coronavirus vaccine for a long time, because they look at burden of illness, right, of how many people are getting sick by that. But they've not been able to do that. Number one, they've not been able to introduce a coronavirus vaccine because the RNA vaccines cause high antibody responses, but when you get re-exposed, it causes inflammatory autoimmune disease.
Yeah.
So they say don't, you know, you have to be really, really, really careful with doing an RNA type virus. It's for humans. That's the one thing.
And one of the things, I suppose, I've been highlighting that here because, you know, a lot worldwide and in Ireland and America, they're saying we want to have the lockdown until we get a vaccine. What I've been saying is they've been working on trying to get these vaccines, and because of these issues, there isn't one on the schedule, and because of viral interference and examples like RSV and the study from the U.S. military, that there is no, you know, and those vaccines are not on the schedule because of these issues that people can die or be severely affected when they come across the coronavirus again. So that's why this is relevant. Isn't that right, Sherri?
Yes, it is. That's exactly why it's relevant. And the second part of why it's relevant is because the U.S. military did a study, came out, I don't know, just pretty recently, like within the last couple months, for sure.
Yeah, Great Wolf, I think, in 2019.
Oh, I think I thought it was more recent than that. But anyways, what they showed was that if you'd had a flu shot, you had a 36% chance, greater increased risk of developing an infection by a coronavirus vaccine. 36% increased risk of developing coronavirus illness if you had a flu shot. So by going out and telling everyone, oh, if you get a flu shot, at least you won't get the flu, well, maybe. And if you do get the flu, it'll be milder, well, maybe. And if you get the flu shot, then maybe that will keep you from getting coronavirus illness. Absolutely not.
Hi, my thought for today is about escaping from your comfort zone, and I've just done that because we've just finished making our first Singing in the Rain podcast with the amazing Max Pemberton, psychiatrist and SANE founder Marjorie Wallace. And I'm just reminded of a line from Singing in the Rain, which was Eleanor Roosevelt, who, oh my God, facing something that scares you, do it and you'll feel better.
Well, hello,